The Enrich programme is a programme which we have been completing in partnership with the Public Health Agency and with a number of residential nursing homes across Northern Ireland. It's very much a programme about enriching the lives of residents in care. Things don't happen in isolation. So residents don't live in isolation and staff don't deliver care in isolation. And what makes a difference is that if we all communicate in the same way, then we start to deliver care in a better way. And it's really simple. It's just about making sure that we enrich the lives of older people. It's as simple as that.
It was the older people themselves that said that we want to start off the Enrich programme by having a conversation to help people to reflect on why they got into the business of caring for older people, hearing what older people would like for their care, finding the common shared space that there is. It puts the voice of the older person right at the centre. Enrich was really about getting people to think about their work, think about the team that they're working along with. And the idea, if you enrich the environment for the people to work in, you enrich the environment for the people who are living there, you just have a better outcome for all the people that are involved. The unique thing about the Enrich project and the unique thing that AGNI does that differentiates us, we put the voice of older people at the very heart of all our business. It's older people that act as the check and balance through our consultative forum. They are involved in collecting the information. Co-production is at the very heart of everything that we do in AGNI.
It's a programme that's been developed by AGNI along with other authorities to promote the ideas and desires of older people, especially those who are in care homes. People from AGNI will come to places like this and spend 2 hours or so with the staff where we have a presentation which covers most of the information and points that we gathered when we were setting up the programme. It's usually a member of staff and then a person like myself. I'm a volunteer with AGNI, I'm on the consultative forum and I'm what's known as a peer facilitator. So I come in here along to support the staff.
We're a values-based organisation and I think the best value that we have is having older people right at the centre and driving the ethos of everything that we do. It shows in the quality of the output and the fact that, you know, we have got so many volunteers who are so deeply committed. They bring a quality and a steer that you couldn't dream up unless you were an older person yourself and unless you had the lived experience that adds depth to the work that we deliver.
Well, that was the first I've ever done a session with AGNI and it was very helpful. Even though we do our training, it's still good to hear more and you learn something every time you go to one of these. You know, you come in here and you're given 100% your time and your patience for these residents because that's what they're looking for. They need you on a daily basis to help them. People don't come in and do this job just because it's a job. You have to have a caring nature and it's essential too to have this type of training.
We're all living longer, but I think it's important that older people can also live well. Our plan, Delivering Together 2026, is a 10-year transformation programme for the delivery of health and social care right across Northern Ireland to ensure we all live long, healthy, active lives. And so the transformation programme is about helping staff and helping citizens and those who deliver services to understand that we need to do this in a different way. So the Enrich programme is an innovative way, which is really about working in partnership with others and listening to the experience, particularly of those who use our services, but also to our staff who deliver services, and understanding effectively what is important to older people and not what we think is important to those people.
Health and social care in Northern Ireland works if partnership works, working together to develop best practice for supporting older people to live in a community or residential nursing setting. Mixed economy of care is important because it really supports the ethos that care can't be delivered in isolation. We need the experience that comes from carers, we need the experience that comes from the support and care staff. We need to be able to listen to our residents and make sure that we capture what they need and what they want. And that's all provided within a framework of supporting the work of the statutory sector, which is to deliver health and social care in Northern Ireland. We've got to work as a team for success. For the future, I think that looks at what happens in hospitals and what happens in care at home. And that would be the next phase for us.